Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. Hi, everyone. Welcome to the Transforming Healthcare Coaching Podcast. And we are so excited for this week where I get to talk with Dr. Vicki Landers, who is a physical therapist and coach and teacher and speaker. So, Vicki, I just want to let you introduce yourself to our audience.
I'm Vicki Landers, and like she said, I'm a physical therapist and a leader. Mostly now, I am a coach and I am a professional speaker. And my goal is to help people look at things differently so that they can experience a better life.
Thank you so much. And so you and I have so much in common, having both practiced and led in healthcare for a long time before finding coaching and starting our both simultaneous mission-driven careers to help healthcare professionals, our colleagues, to discover and become something different energetically. So you and I both graduated from the same training program, IPEC, the Institute for Professional Excellence in Coaching. And I was wondering, would you be willing to tell our audience a little bit about your journey and story about your healthcare career?
Oh, absolutely. So it started a long, long time ago in a land far, far away. No. So I graduated from university in 93 as a physical therapist. And I went out into the world and I started taking care of patients. And I did that for about 11 years before I had the first opportunity to be in a management position, which had been my goal the whole time. I remember interviewing for something back in 96. And the woman asked me, "What do you want to do?" And I'm like, "Well, I want your job." That's not the best way to have an interview, just saying. But I knew it early on that leadership was something that was really interesting to me. So I did my 11 years, and finally I had a really good opportunity to step into a management position where I was in charge of home care staff. There were like 30, 35 PTs, OTs, and speech. And I was still using the word management. And I use this just now intentionally because my thought at the time was you make people do things, you tell them what to do, they must do these things. And somewhere along the way, I realized, okay, that's not leadership, that's management. I finally shifted into this idea of leadership is about inspiring others and bringing others along, but I still didn't really understand what that meant. And I was still getting frustrated because I didn't understand that. And I was trying very hard to understand human behavior. Why is it that some people, some clinicians did all of their documentation and got it done and showed up and patients loved them? Why is it that some people, patients loved them and they never did their documentation? And I was having issues understanding. Why is it some people were doing one thing and other people's were doing different? And that's when I went into this idea of I want to understand human behavior and I want to understand motivation, which is where the coaching came in. Not knowing what a coach was, I went into the coach training program and came out of it with this completely different way of thinking about interacting with people who were having challenges and understanding that they're their challenges, not my challenges. And so that idea, and I started working with people slightly differently, leading and managing slightly differently, and realizing that that was more of my calling, talking to people and helping them change how they see things. So about 3 years ago, in order to start my own coaching practice and speaking business, I sold the house, quit my job so that I could afford to quit my job. And it was the scariest thing I've ever done. And I'm really glad I did it. Opened up my coaching practice where, as a coach, I really like to work with mid-level healthcare professionals who are at this point of I've done everything that I had planned to do, and I'm now 45 years old. Oh, is this all there is?
Right.
Helping them sort of navigate the rest of their careers. But that's how I got to where I am. And so I just love to help people see things differently that make an impact in their lives.
I love that. So it's a really interesting journey indeed. And when you think about why you went into the practice of physical therapy and then seeing that there were opportunities to lead teams and manage teams, and then the natural evolution to also recognize that there's so many more doors later than what you first initially started. And that's normal in life. And I think we often don't do a great job telling our kids or telling college students, or even when we're incurring all that debt to go to school, that there are going to be so many things that you are just not aware of along the way.
I think it's a beautiful statement. And because I remember sitting in my interview for PT school and they asked, well, what else do PTs do besides treat patients?
Ooh.
And I remember this very well because I was like, well, I don't know. And I was trying to come up with things. And then by the end of the conversation, well, they teach and they do this and they do this. That was my first inkling that when you get trained to be a PT, you're actually being trained how to think, and that how to think translates into so many other open doors. And if you just kind of look around for it, you can find things that you're good at and that feed your soul.
And let me just say, you've had some very interesting interviews. You already mentioned 2 different ones so far already. And so they're obviously very pivotal in your journey for how you decide to shape your career. I'm curious, what did you love the most about your clinical and leadership journey and opportunities?
Part of it was thinking. I love to think through problems. I love there to be a problem in front of me that I know there's an answer to it, and I can figure this out and put this whole puzzle together. That's something I've always loved, because I've also left out that I spent a number of years being a healthcare software analyst and strategist.
You kept that secret from me.
Yeah. And so, but it was all about the puzzle. It was like, we
Mhm.
have this thing that we want to do and we have this tool to do it. How do we figure that out? So that's something that I love, whether it's taking care of a patient, whether it's working with a staff member who's frustrated about something, whether it's we're trying to figure out how to implement a new regulation. It's how do we do this with the least steps possible, the least friction, helping people go through change with the least amount of trauma and drama. So that's fun for me. I love that kind of stuff.
That's so awesome. It's great that you are able to find things that align with your values all along the entire journey of going right into a science-based field, into a place where you had to lead humans, which are very not scientific oftentimes. We're also very emotionally led. And then also find the skills and the programs and the training and the perspectives along the way, and the fact you are still learning and you're still leaping and still trying different things, that it's a lifelong journey for all of us. And I think that's really commendable. And it's also something that we don't often get to talk about or see. A lot of times when we mentor high school students or college students and you're trying to think about what should I do, and the decision seems so filled with weight, the reality is we often don't get this opportunity to hear stories like yourself, and even just reflecting what have the last 15 years looked like and what were the mild inflection points. I'm curious, as you coach mid-career managers and leaders, how do you help people find those inflection points?
So we do a lot of reflecting back. Why did you choose the career that you have? And so you'll get lots of answers. Sometimes it's the science.
Mhm.
Sometimes it was that a family member was really helped, or sometimes it was an experience they had. And that's how they've landed that. And that when you get into something, you don't necessarily know everything there is to know about the career. But what I see is kind of difference. People who got into clinical care and want to stay in clinical care, and they're looking for ways to grow within their clinical practice, whether it's a specialization. And so we talk about going back to why did you get into this?
Mhm.
And sometimes they're like, I did it because it was interesting and it was challenging, and I'm no longer feeling challenged. So at that moment, people might start to look at other opportunities that are maybe extra clinical. So whether they're going to step into a leadership role or they're going to go do something entrepreneurial. So it's just giving them that moment to recognize the why and the why behind what they do, and letting them tap back into that, because we tend to forget. We're going along our lives and we're like, well, I'm doing what I'm supposed to do because I got this degree, which means I'm supposed to do this. When people can let go of the I'm supposed to and I should,
Right.
so fun to watch their eyes get wide and they start to see possibilities and they start to see opportunities that have always been there. They just didn't know it.
Right. And I would say that probably what people forget is that we do love to learn and grow. Everybody loves to learn and grow. And then you were talking a little bit about how people are motivated to change, and will be anywhere from our patients to our colleagues to ourselves. If it's not slightly a little bit interesting, you're going to be bored now in this day and age, aside from TikTok and fancy videography. The reality is, it has to be somewhat curious.
Curious, and actually, you brought to mind something that I've been thinking about a lot recently, which is conscious choice
Mm,
and being present and being authentic. As I am working to build my business and to get my message out there, it's so important that people know who I am and that I'm being real and true. And I think that sometimes people lose sight of that. It's like, I need to look like this on TikTok. I need to look like this on Insta, and helping them be, no, what you need is to be you
right.
and to be genuine and to connect that way, because that's going to help us all be a lot more satisfied with our lives and with the people that we interact with. It's just going to improve things so much more when we're really being ourselves. And
Right.
I think we lose sight of that sometimes.
It's funny how we often forget the greatest power is in our own story and also to be able to own it. I think it's that reconciliation of being okay and proud of it rather than apologizing for it or trying to be something different or thinking there's some correct answer that you can put onto a personal state. There really isn't a correct state that you can put on there, quieting the inner thoughts that you have that may lead you astray.
Yeah. And also listening, because there are thoughts that we know lead us astray, but then there are also thoughts that were like, I should have listened to that years
Mm.
ago. And so being able to discern the difference between those two is incredibly important and super useful.
Yeah, that's a really great point. A lot of times that inner intuition, whether it be a clinical
Right.
decision or making the right choice, is something making it not sit right. And it's hard to understand what it is because it's hard for the logical mind to try to explain the intuitive mind.
Yes. And I think that's something here in the US we could actually do a little bit more of is listening to our intuition. It
Yeah.
comes from our wisdom. It comes from our years of experience. It comes from inside of us. Just listen.
And every experience does lead you towards the correct way for you in that moment and to be able to trust that. So I want to change topics a little slightly. You and I both have very aligned thoughts about helping the frontline people of healthcare, from leaders in development, emerging leaders, senior executive leaders of all professions. That's the mission of Transforming Healthcare Coaching. And that's actually your mission as well as coach and speaker. And so, what is the most important message that you often talk about during your talks to the thousands of people at a healthcare conference? I'm curious what it is that you try to impart to people when you go speak at healthcare conferences.
So the most important thing to me is to help people understand that regardless of their role, their position, their title, they can be a CEO, they can be somebody who does scheduling, talks to patients on the phones, somebody who actually is the clinician working with the patient. Each and every one of them impacts patient care. And each and every one of them has all of this stuff that's coming at them, whether it's increased productivity, reduced payment, scheduling challenges, the continual advancement and change and cognitive load of technology. We all are experiencing all of this stuff that's coming at us that feels like it's not necessarily aligned with the purpose of healthcare. If we can step back for a moment and recognize that all of that is just distraction, and during your day-to-day life, most of it's something you can't control. And so understanding that you wear a lens and whatever lens you're wearing at that moment is how you end up reacting to what's happening to you. So I like to bring this idea of a lens that we wear glasses. We wear them for reading, for
Mhm.
computer, for distance. And those lenses, when we change them, we discover there are things that we didn't see before. This is what I talk about is the idea of what lens are you wearing? And what are the other lenses you could be wearing? And how would that change your experience? And how would that change the experience of the people you work with, your coworkers? And how would it change the experience of the people you serve? Whether it's a patient or your peers or it's your leadership. But that's in a nutshell what I talk about and what I help people to see is how they can look at things differently.
Yeah, I love that. I think it's funny because a lot of people really feel that it's always the system's fault. And I think you and I both know that it's the system's fault and it's also our fault.
Yeah.
The reality is, and that's an unpopular opinion, so I'll just put it out there for YouTube. It is an unpopular opinion that we actually can contribute anything in that moment. And at the same time, I can tell you examples of lots of people who do own the moment. That front desk receptionist can make a huge difference. I can tell when they're a little frazzled. I can tell when they haven't had their coffee in the morning. I can tell when he or she's at her best. And it makes such a big difference, that very first person, even from check-in. And I know our front door people and our security people think they don't make a difference, but they are beloved if they can somehow wear the lens of gratitude and joy because they know that everyone around them is sick. There is zero human that wants to walk into a hospital, even for routine blood draws. Like there is zero people who want to be in the hospital. And so the fact that there's some people that we do work with who are just able to bring it every single day without fail and show up in that way really does make a huge difference. And I don't know whether you have other stories too in your
Yeah.
experience.
I have a great story about a visit that my mom had at a podiatrist's office and about my encounter with the woman behind the desk that was less than favorable. And so, yeah, there's lots of stories of this, and we all have them. We have them on both sides. We have them as clinicians and we have them as patients. And So when we understand the impact that we have on each other, we can start to understand that we influence people. So I have this thing that I say, it's that our energy creates the attitude that we bring to any situation, and the attitude results in our behaviors. Our behaviors are influence, and that influence creates the culture within any organization. And that energy starts with what lens are we wearing? And like you said, systems are part of the problem, but we also can't be effective in changing the systems until we change how we look at the system and we stop blaming and complaining. And instead we get to this idea of curiosity, and we show up with curiosity and less judgment. Then we can engage in fixing the problems.
Yeah. And it's really also fascinating to me. I think there's some people in the building who actually can watch it happen live. It's just like a soap opera, and certain staff rotate between multiple different floors, multiple different departments, and they know where the positive energy is. They know where the good food is. They know where there's certain leaders that inspire confidence. And you see it pretty routinely in any organization. When you get to the highest level, it's really hard because there's so many micro groups out there. And I think the most important thing when because you coach the emerging leader or a unit director that just got promoted, those people make the largest difference of the frontline coalition work group. And it's a group that's often forgotten. We often give coaching to the C-suite. We often give coaching to the department chairs, but we often forget about the very frontline assistant manager. That person has a lot of influence.
Oh, yeah. I'm so glad you said this, because this is something that you're right. We give the executives, which they absolutely need coaching. Totally, totally agree with that. And that person who was an amazing clinician who just got promoted to a leadership, even a supervisor or leadership position, because they were an amazing clinician. And then we don't help them. We don't say, okay, now that you're in a leadership position, this is what's different. This is your role in this position, which is not the same as being that stellar clinician. And we promote them, and then they flounder. And I love to see when we give them more support so that they can navigate this new position and who they want to be in that position and how they want to lead and support their staff.
Yeah. That's part of the reason why I start transforming healthcare coaching, was because I recognize there is such a continuum of that life cycle journey that we have forgotten an entire large group and they're the largest reason why people leave the institution. Our churn and turnover is because of the middle group that don't have any support and training or time and new roles. And I just wish they were back to just being a frontline clinician again. I don't know how many managers or leaders, at least a year within the first year, you can make it past a year, you might have a hope. But in that first year, they're like, I give it back? Earn this promotion?
I've seen that happen. I mean, I've seen clinicians get into leadership and then return back to direct patient care. I've watched it, and they were good leaders, but they were so tired because they weren't getting the support that they needed at the time. And I look back in retrospect and, oh yeah, I see totally how that happened. And I want to help that not happen, because growth as a leader, it serves you in every single facet of your life.
And I think it's funny, as we created the company, a lot of healthcare professionals pushed back at us and said, we don't identify as a leader. And then I pushed back again and said, but don't you lead your own life? Don't you lead the care that you have in just the one patient that you get to see, or two patients you get to see? And so the question is also, can we think about leadership as something that we all inherently have when we lead our own lives? And so as you work with your clients, what are some common things that you often talk about with your clients about leadership?
I have a statement, and it's very much aligned with what you just said. Leadership is not a role, a position, or a title. Leadership is behavior, and leadership is about who you're being. And so we talk about, who do you want to be? When somebody comes to you with a challenge, who do you want to be? When there's a problem that you've identified, who do you want to be? Do you want to be the person who gossips and blames and complains? Do you want to be the person who cares for everybody? Do you want to be the person who gets curious and solves the problem? Are you the one who wants to find resources? Who do you want to be when you encounter something that you might perceive as challenging? And that's a lot of what we work on, is who do you want to be and how can you be that?
I love that. It's funny. Sometimes I feel when I pose that question, people think, and they're like, I'm not sure. And then you get really scared. Oh no, I don't know my why. I don't know my purpose. I don't know my values. Oh God, what if I don't know who I am? And there's a scary moment, I think, in all of our journey as being a client and also being a coach. I might need to sit with this, because I shouldn't just have some kind of stock answer. It's actually, who am I really? What are my values? And who do I want to be in that moment?
And the quietness is real. that I don't know, which is why I think coaching is so fun, because it's that space. Who thinks about this in their day-to-day life? Well, we do, but we didn't used to. So giving that space
Mm,
for somebody to explore why I am the way I am, or why I'm doing what I'm doing. Because I went through a period of time where I was like, oh, I'm doing this because this is the next step. You graduate high school, you go to college, you graduate college, you get married, and next and next. And somewhere along the way, I was like, wait a minute, I don't have to do that, which was this huge epiphany, but it didn't come young. And so I think that the coaching space gives people the chance to look at the stories they've told themselves about what they have to do and open up to maybe some what you can do.
yeah. And that's a really great example too. Obviously, we always had mentors and advisors, people who would show us the way in all the things you just mentioned, that it's the next right thing to do. It's the next step. This is what a career looks like. This is what you're supposed to look like. And then at some point, you start to question that. And for some of us, it occurs earlier. For some of us, it occurs later. And at the same time, for some of us, if it never comes up, then that's also okay too. I think a lot of times people are like, I'm really content with where I am. I'm fully understanding where I am. Then that's also good too. However, if you want to go into a place where you don't know where to go next, like entrepreneurship, like a bigger pivot, that's where coaching can help you find the new, right? Find the unknown, listen to yourself, and be guided in the right ways rather than the external forces.
I think people make their own choices, because you're right. Some people came to their calling and they love what they do. And that's amazing. And that's fantastic. And no change required. Some people haven't. I also think that's what's fun about working with people.
Mhm.
No two people are the same. They haven't arrived at wherever their space is through the same pathways. And there's so much more to us than we really take the opportunity to discover.
Some people also say that it's a little bit scary and it's also a little bit exciting. That's the two same cortisol, adrenaline feelings that might be associated to be in healthcare these days. There's lots of young people who are listening, they're just graduating and they find it to be a little bit scary because they're defunding and shrinking federal research and public health. There's staffing challenges, there's supply chain unpredictability. Why do you feel that it's still an amazing time to be in healthcare? Because I know you teach undergrads, I think, in physical therapy. Is that
Yeah,
correct?
actually, I was teaching undergrad and I was adjunct. And now I just got done teaching a graduate course for occupational therapy students. And it's really fun because they're young and they're fresh and they have the opportunity to really make an impact. But the thing, it's the why. Why are you going into healthcare, and understanding that being able to serve others is a privilege, and being able to help others and to grow a skill set that really makes a difference in other people's lives is going to make you feel fulfilled, and you're going to feel like you're doing work that has meaning to you. And so I think that's the biggest thing. And good grief, the science is fascinating. If you're at all inclined to want to understand how this human body thing works, there is so much research being done and there's so much more being learned every single day. Regardless of cuts, there's still research being done and we're still learning about how to better care for each other. And I think that makes it a great place to be. And you're getting to interact with people. That's the other thing, is that when you're a clinician, most clinicians are interacting with people. And so you get to have that relational, genuine, authentic connection with people. And I think there's a lot of value to that.
Yeah, it's never-ending learning, right? You'll never be bored in a way to help people, and no one's ever gonna really turn away a service of someone who actually can help people in many different ways.
Yes.
And so I'm
Agreed.
curious, do you have any last thoughts you would like to share with our audience?
I just think the biggest one is that if you are open to it, to start to just be aware of how you might be reacting to the things that are happening in your world, especially within healthcare, because there is so much that you can't control right now. But take that breath, take that moment, think about who you're helping and how you're helping them, and know that what you do really makes a difference. And it may not be apparent to you, but you are helping people and you are making a difference. And don't forget that.
Yeah, no, I am always grateful for every single healthcare person who I see. We're all patients too. So all people in healthcare, we're all patients too. And when we think about how we want our loved ones and ourselves to be treated, we're lucky to be able to have the intelligence and the advocacy and the ability to know how to get better when things are broken, when we get sick, when things are not right. We do need people who can be there for that space. and get people better. And also for the people in the well-being space and the primary care space and maintaining and preventing things, also vitally important.
I have more stories pop into my head. I'm an aging mother who's acute rehab, skilled nursing, assisted living, and we're navigating all of these different things right now. And she needs an advocate, and I am that advocate. It's such an important part of I'm using my skill set that I developed over time to advocate for my mom. So that's a whole nother realm of what I do.
I think that's the amazing thing as being a healthcare professional for all the younger people who are listening, that we all have something to be able to contribute our knowledge and skills. And whether you're doing it as a manager or a leader, non-clinical, research, influencer, educator, everyone's being helped by that. There's so many opportunities out there, no matter what profession you're in, as part of the team to be able to advance the well-being whenever people are sick and also when they're well. Fun question time. It's a fun question time. What great books or newsletters are you consuming these days?
Okay, so I'm a little late to the game on this one, but I just finished reading When Breath Becomes Air.
Yes.
Which was, have you read that one?
Yep,
By the neuroscientist out of Stanford who was diagnosed with cancer. Amazing book. Yes. Tears and wisdom.
Yeah.
He just so much wisdom out of that. So that's actually one of the things I read most recently. And then I also just finished Tipping Point Revisited.
Oh,
Tipping
interesting.
Point.
I have not read.
Malcolm Gladwell went back to Tipping Point and he planned to write just an updated version of it. And instead he wrote a whole new book.
Oh, interesting.
Yeah, there's a big chunk in it about the stuff that happened with Purdue Pharmacy and the drug maker. So it's a really good book. He always makes you look at something from a slightly different angle, and I completely appreciate that. So that was the other one I just finished recently.
Awesome. Thanks so much for sharing. So thanks so much for coming on and talking with our Transforming Healthcare Coaching podcast. And again, how can people work with you?
So you can email me at Vicki@VickiLanders.com, or you can go to my website, VickiLanders.com, which is my speaking website. There are links on there that you can find me on LinkedIn. I'm on LinkedIn a lot. So Vicki Landers, PT, I think that'll get you to me. And I'd love to hear from people. So anybody who's heard this podcast who's like, hey, I'd like to talk to you. I'd love to talk to you. We can set up a time and chat. And I'm open for any speaking engagements where I can help people change the lens that they wear so that they are more satisfied and have a better experience, which makes the patients and everybody around them have a better place to be.
Awesome. Thank you so much. Thank you, everyone, for listening to Transforming Healthcare Coaching podcast. And again, please share with a healthcare professional, colleague, friend out in your networks. Like, subscribe, and share. And email us at podcast@transforminghealthcarecoaching.com for what you want us to talk about next. So, till next time.
Bye.
Bye. Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call, free, at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.